Hey guys, today I'm here with Dr. Mwamba and Dr. Bridges, and they're going to do a body hair transplant into the scar that I have from the second hair transplant surgery that I did with an unnamed surgeon, but it was not Dr. Daniel McGrath, who's the guy who did my last one. But the surgery that I used for my second surgery left me with this scar, which we'll show you some pictures of later. And Dr. Mwamba and Dr. Bridges are going to fix that, and with a body hair transplant. I had some questions about body hair transplants and how that might be able to make you a hair transplant candidate if you wouldn't have been before, based on the donor hair that you had in your normal donor region. So do you come across many people that wouldn't have been a hair transplant candidate without the body hair, that you feel like body hair like puts them over the edge of being a candidate based on their donor area? Or is it more just like an extra kind of thing?
Oh, I will say the first time that we started body hair was because of the depleted donor area from strip surgery. Because remember, in the year 2000, when we were doing strip, people were doing strip in different levels because they will take the first strip, the second. So you'll have somebody with like 5, 6 strip, one after the other, and no donor area.
Okay.
So when FUE came out, we just realized like, oh, we can use body hair, because we can take them, easily. Because some physicians tried that before, but a strip, like on a beard hair strip, but then the scar was also terrible, and it was on the face. But when body hair came, and when the FUE, we get the FUE, so we say, oh, we can still take the beard hair or whatever without leaving any scar, because it was so tiny. So that's where the idea came, and we're starting to kind of proposing like the body hair to patient.
Okay.
And it was mostly at the beginning for those who were kind of depleted. So
Gotcha.
it was like nothing to do.
So at first you started doing body hair transplants basically because there was almost no choice. It was like you don't have any other donor hair. But now at this point, are you sometimes using body hair as like even when there is choice, just as like, hey, we don't actually have to take all of your donor hair at this point. Let's kind of mix it up.
Yes. Now body hair kind of came to the new level where it's an add to the value of hair transplant. Because like, let's say we have today a lot of people who are class 5, class 6. And when you look at them, you say, scalp hair by itself cannot be sufficient. But they have great body hair. And then you can use that. And
I wonder if they thought that, or they're like, I have too much body hair.
Yeah, that's what I said. Don't.
No, you have great. So this is funny.
Take them.
Yeah, Dr. Mwamba is mad at me because I had actually laser hair removal done like years ago. I always shaved my chest and worked out, and like I kind of liked the way it looked, and so I got this laser hair removal done, and now it came to see Dr. Mwamba, and he's like, what the heck did you do? You destroyed all of your donor area.
Yes, because like today I usually tell a patient like, hey, do your hair removal after you make sure like you have all your head hair.
Yeah.
Because I think what is great with body hair, of course, it grows. Like at the beginning, we were kind of worried, is it growing? The cycle is different. But now today, we know that it grows. Okay. The only thing, and what makes a difference now, is the matching. And as I told you, your leg hair cannot fit like for density, but it comes for softness, for things like that. Beard hair is coarse. So when you start to play with that art, then you can achieve great things with body hair.
Interesting. Yeah, so your leg hair is kind of more soft and fine. And so Dr. Mwamba was saying how that was really nice for putting like soft edges on things, things like hairlines and temples and things. Yeah. But then like my beard hair is quite coarse and thick. So it's going to be great for density, right?
Density and coverage.
Wow. And so Dr. Bridges, like when did you start doing body hair, and what's one exciting thing about body hair for you? What's the first thing that comes to your mind that you like about doing body hair?
Well, it gives us such a broad palette to paint from. You have everything from beard hair, which is quite coarse. In your case, for instance, you have coarse scalp hairs, so it's a great match. That's not always the case with people. But that, as you mentioned, leg hair, extremely fine, great for softening up hairlines that need that. it just adds so much to the palette, if you will, or to the toolbox. And I think beard is very close to scalp hair in many cases, and it's just it's pretty easy to harvest, and it just because of the coarseness of the caliber, it gives a lot of coverage, a lot of bang for the buck, so to speak.
So, Dr. Bridges, how long have you been doing body hair transplants, and what have you learned during that time? How long did it take before you felt like, okay, I'm kind of getting the hang of this? I feel like a lot of people think, especially with FUE, that it's really simple. You just, as long as you've got a device and you know how to punch some skin, you can extract grafts. So, and let me know if you think that's the case. But I would love to know kind of what you think. You mentioned, being in kind of an art, in your palette. You do look like an artist, and so yeah. What's your story with that?
Well, Patrick and I have both been, or Dr. Mwamba, to be formal, we have both been doing body hair transplantations for about 15 years. We started back in the early 2000s. It just wasn't being done with any frequency and by very few hair transplant surgeons. And so, there are a lot of unknowns, obviously. So, and some of the unknowns, well, which body hairs are going to be the best? There's leg, back, chest, abdomen, beard, all these factors. And, is it going to grow? And what are the growth characteristics going to be? How is that going to correspond to the growth characteristics of scalp hair? And all those things sort of evolved, and we learned more and more as we continued this process. And now there are a fair number of people out there that do it, especially with the burgeoning popularity of FUE. What we did learn is, yes, it does grow, but you can't necessarily track that with the way you would with scalp hair. You can't tell someone, well, it'll come in at the same time a scalp hair transplant would. And those sometimes it's delayed. It may have different cycles. It may go through the cycles of anagen, telogen, those sorts of things differently than scalp hair does. But those are just some of the things that we learn. We know that it grows, and we've learned, some of the things are relatively intuitive. Coarse would be good for density, fine would be good for softening areas that need it. But those things we had to find out. Other things were just sort of practical things. For instance, if someone's going to have body hair transplant, we have them do a wet shave a couple of days before the procedure, because then the hair is growing. You can see the ones that are in the active growth phase. Okay. The ones that are in the resting dormant stage are not going to be growing out above the skin. And so under magnification, you can see the ones that are in the active growth phase and target those specifically. Oh, and then make sure that your results are as good as they could be. Early on, there was a tendency, let's just take everything. But then, with some experimentation, we learn that, you're going to get optimal results if you make sure you're only harvesting hairs that are in active growth phase.
What do you think is needed by a surgeon as far as the experience in doing body hair transplant? Is it something that is like very much a specialty? How much time do they need to have been doing it, do you think, to be kind of an expert enough that you think they should be doing patients regularly? Or kind of what's your take on that?
Well, obviously, anyone that's going to do that needs to be well-versed in FUE first of all, scalp FUE. And, we get Dr. Mwamba's take on this, but I think, someone that's going to attempt body hair should be doing FUE regularly for at least, a couple of years, I would think. And, just having the same feel, the same technical expertise, the same way of using the tools that we have, minimizing transection, maximizing the harvest that way. So, it's very similar to FUE, scalp FUE. So if you've got the tools to do that, if you have the skill set to do that, and you've got some time under your belt, then you're going to be a good candidate as a physician for doing body hair harvesting.
Okay. And Dr. Mwamba, as far as the tool, I know there's a lot of emphasis put on tools that surgeons use because one, it's generally a better marketing tool, like marketing tool as well. So what are your opinions on tools? You know, all the different FUE tools. What's your kind of take on that, and what do you use personally?
Today, even I want to talk about tools. You have the machinery like a robot, you have all this device. And most of the time people are kind of, oh, let me use the device because the device is great. No, the device is not great because even though I gave you the device, you will not perform the same way.
Yeah.
So to get to that, you have to have a feeling. You have to have a connection between the device and you. You have to kind of fuse. And when you get to that point, it takes practice and practice. And then at that time, it becomes like just a reflex.
Yeah. And how many years were you doing FUE before you felt like, you know what, like I've really got a great feel for this?
I would say 5 years.
About 5 years.
About
Wow.
5 years.
That is a lot of hole punches.
Before punching and punching. And then at certain point, and I was just observing, you know, at the beginning when we started FUE, I was just observing, even though like the way, because I used to work with John Cole, Bridges was there, but I was just looking at, oh, now how he's punching. I will look at Dr. Cole because he was the one. And I will look at even the technician, how you take the tools. So all the time, when I'm using, I'm trying to figure out how can I improve? How can I improve? And then at the end of the day, I just figure out like, oh, you don't have, and every time we were kind of let the tools work. But to get that concept, it takes time. It took time.
Yeah.
For me to understand, like, you really, really have to understand how the tools work to let it work.
Yeah, that makes sense. I feel like it's kind of like, as a musician, I'm thinking it's the same as playing guitar. And someone says, well, just let the music flow. Well, that's true. And like when you have the skills after 5 years of playing guitar to let the music flow, suddenly you understand what that means, you know, and what it can feel like. But it definitely takes those 5 years of practicing guitar before you understand how to let the tools work, you know?
Yeah, that's what I say. You know, to master something, you have to use it like 10,000 times before you really get to a point where you say, I'm mastering this technique, I'm mastering this way. So, and practice is the key. Practice is the key. And not only practice, because, you know, what I want to even to emphasize today is just a lot of physicians, especially when we started, people were kind of saying, learn from your mistake. You know, that's kind of, yeah, that was like, everybody said, oh, you have to learn from your mistake. Yes, but today, don't learn from your mistake because your mistake can ruin the life of somebody.
Yeah.
Don't
learn from your mistake on me, please.
Yeah. So you can learn by being coached by somebody, by working with alongside, because everybody wants to jump on it and start doing, like, as you say, oh, BHT is like FUE, I'm doing FUE, let me do BHT. No. Body hair has its own specificity. So just go work with somebody who knows how to do it. Yeah. So it can help you also to avoid mistakes. And you can learn from the experience of others. I prefer that, to learn from experience of others than to learn from my own mistake.
Amen. Thanks for watching, guys. I hope this helps you out. We got some more videos coming on body hair transplants as well as the surgery video of my own surgery. So check that out.